Hi everyone, my name is Mike Bryan. I'm happy to here today to have Maria Rock, the Client Care Coordinator with Home Instead. Hi Maria.
Hi.
All right, thanks for coming today, and I appreciate you taking the time. And as we've talked already, this is a way for folks to find out more information about Home Instead and get a better feel for what services are provided. So first things first, can you let the folks know address and phone number and email for you guys?
Sure. Home Instead here in Muskingum County is located on 14 North 5th Street, Suite 124. Our phone number for the office is 740-453-2100. And the Home Instead for Muskingum and Licking County, the email address is www.homeinstead.com/550. If you're trying to reach me directly, my email address is maria.rock@homeinstead.com, and my cell phone number is 740-920-5021.
Okay. And I know also your website, homeinstead.com, it has some resources on there too that they can find you guys directly there. And I know you have to go to, if you go to homeinstead.com, you can find Zanesville's group, but if you go /550, that will take you directly to it, right?
Yes.
And so once you're there, I noticed earlier that there's a pretty good set of resources on there that helps explain the process, and folks can see how that works, but we'll actually talk about that here shortly. So
Okay.
we'll come back to that. But can you describe, when folks hear home health care, they probably have some general idea of what that means, but can you describe what it means for Home Instead?
Sure. So Home Instead is a non-medical home care company. We provide caregivers, which we call care professionals, to the home, and they can help with self-care tasks such as bathing, dressing, toileting. They help with meal preparation, light housekeeping tasks. We offer transportation to appointments, grocery stores, or just general outings. We also do medication reminders. So because we're non-medical, we cannot, dose or prescribe medication, but if it's set up in a pill box, we can give reminders for them to take their medication.
Okay.
We offer specialized services such as hospice, bedbound, Hoyer. We work with veterans. We have dementia training, so
Sure.
we will help people who have dementia or Alzheimer's in their homes. We also go into facilities, and we can help with care at the facilities if someone's looking for some more one-on-one time with their family or loved ones.
Okay, so if someone is in assisted living or skilled nursing, they can have you guys come in as well?
Yes.
Okay.
Yeah.
All right. So it sounds pretty comprehensive there. And again, as you mentioned earlier, non-medical, but there's a whole bunch of other things that are non-medical. Again, help with activities of daily living, things like that, and reminders for medication. So, okay.
Yeah.
All right. So that makes sense there. Now, if someone is curious about Home Instead, again, we mentioned already they can get on the website and see what services are offered, but more often than not, people want to see reviews too. It's no different that if I was buying a new TV on Amazon, I'd want to see what the ratings were. What are the best resources for folks to see reviews of Home Instead?
So the best places to go are caring.com.
Mhm.
And you can pull up Home Instead franchises and look at their reviews. You can also go to Google. Just Google Home Instead Zanesville, Home Instead Granville, and then it'll pull up all of our recent reviews there.
Okay. Now, if someone has decided that after looking at reviews, website, calling you guys, getting some more information, what does the process look like? If someone is ready to move forward with services, can you kind of explain how that works?
Sure, Mike. So first we would have them talk to our intake specialist, and she will chat with them a little bit about what their needs are, where they're located, to make sure they're in the counties that we provide services, and just make sure that we're an overall good fit for them. From there, she will schedule a in-home care assessment, and she'll set that up with one of the 3 client care coordinators. I am the client care coordinator for Muskingum County, and then we have Linda and Dana who are in Licking County. So with the meeting, we go out preferably to the client's home. We can do it anywhere you want. We've even held them in the office before. If some clients aren't quite on board with it yet, families will ask to meet somewhere else.
Sure.
So we sit down and talk a little more in depth about what your needs are, and then how we can meet those needs for them.
Okay. And then, once you've had that meeting, of course, I know there's some paperwork they're going to have to sign, a contract and so forth. And if they're, just like anything else, that I know there's a lot of paperwork that have to go through. But if they have questions about it, can they take that information with them and get that signed later on?
Yes, you can sign the paperwork later on. We can also email it to someone if they're living out of town, or they have a brother or sister or someone who's going to be the one who signs the paperwork for mom and dad. We can email that to them. Then once the paperwork's signed, it takes about 3 to 5 business days
Okay.
for us to get started.
Okay. And again, services can go on essentially indefinitely. If someone's at home or if they're moving to a different facility of some sort, they can still receive services from you guys. Now, a question I get asked all the time is how do I pay for this? And I think that with you guys, I know certainly private pay and long-term care insurance is something that's available.
Mm-hmm.
But a program that was actually new to me, and you gave this brochure to me, that's the VHA Community Care Grant. Can you tell us a little bit about that?
Yes, we have several veterans that we provide services for. So this is for the veteran themselves. It's not for a spouse. The way this works is we meet with you, we sign all of the same paperwork, but then the veterans are the ones paying the bill. So we have a specific contract with them. It is not income based, so it's different than aid and attendance. They don't look at your income. It is need based. So the primary thing is that the veteran would need some sort of assistance with a self-care task. So if they needed assistance with bathing, dressing, or toileting, or even self-feeding.
Mhm.
And then we can also provide the light housekeeping, meal prep. The one thing we can't do under the Veterans Act and their reimbursement is transportation.
Okay.
So we can't transport the client. However, if the client goes to a doctor's appointment and uses a public transportation such as SEAT or the VA transportation, we can ride with them.
All right. Okay. Yeah, that's a program that I think is probably still underutilized, but so that's good. And as you mentioned too, that's different than aid and attendance. But frankly, aid and attendance is something folks could use to help pay for your
Yes.
care as well. So, so several ways to take care of that. So when we look at, there's a bunch of different home health care facilities, assisted living, skilled nursing, and I think folks are always interested to find what special programs that you have. And a thing you mentioned to me earlier is your caregivers are care professionals. Explain what that means.
So we do everything from the beginning in-house with our care professionals. We interview, we hire, we vet them, so they're fingerprinted, background checked, drug tested, proof of driver's license and insurance, all in our office. And then the reason we've gone to the term professional is we do in-house training. So they undergo a 3-day training, regardless of whether they've been, working in healthcare for 20 years or 2 days. They all get the same training. And then after those 3 days and they've started working, we have many programs to allow them to come in and further their knowledge in specialty areas such as the dementia training, Parkinson's classes, Hoyer and bedbound classes, hospice.
Okay.
So we really work hard to make sure we've supported our care professionals and provided them with as much knowledge as we can.
Makes sense. Anything else that you can think that makes you guys stand out from others?
Well, we have for each county, like I said, we have a client care coordinator, such as myself. I will follow the client from the time of the initial meeting and clear until the end. Part of that includes, we do introductions for our care professionals when they first go to a client. So say your first week, you might have 2 different care professionals coming to do your care on different days. I meet them outside and talk about the assessment that we've put together, and then I bring them in and introduce them to, you know, your loved one, or if you are there, the entire family, show them around, and then that way they know what the expectations are. And then as the client care coordinator, we go every 6 to 8 weeks and we provide a quality assurance visit,
Okay.
so that we're not just forgetting about you after we've gotten you started.
Yeah.
So
Yeah.
the follow through of everything is very important in the communication.
That sounds like it. It sounds like it. A lot of oversight and communication. That seems to be the key. And you mentioned something too about you guys are in the top 10 of client care coordinator retention. Is that right?
Care professional
Care
retention.
professional retention.
Yeah. So we have our care professionals. We have very little turnover of staffing.
Okay.
So once you get started, there's been clients that we've had for 10 years that have had the same caregiver.
That's good to know too.
Yes.
Yeah, I think that says a lot when you have retention like that. So that's good. Well, I think that gives folks a pretty good overview of what to expect if they have questions about Home Instead and kind of what the process is. One thing I almost failed to ask you about was that there's a family room portal. Can you explain briefly what that is too?
So the family room portal allows the client's family to log in on their device and check what we've been doing with the clients. So each care professional has to give a clock out message, and the family room portal, you can see that clock out message. So maybe they didn't get a shower that day. The care professional has to give a reason why.
Okay.
If there's a change in condition and they report it at clock out, the family's gonna be able to see that.
Okay.
So it's just a good way for them to be able to see what's going on in the home daily.
That reminds me a lot of like if someone's in the hospital, there's some apps on your phone that you can see, you know, what the doctor's notes were that day or what was provided. So that sounds like a similar thing. So that sounds very useful as well. Well, but again, I think this overall gives folks a good idea of what to expect, and certainly if anyone out there has more questions about Home Instead, please be sure to reach out to Maria, and I'm sure she'd be happy to help. But thanks again for doing this today. I appreciate your time.
Thank you for having us.
Yeah, you're welcome.